everybody. Welcome to Facial Aesthetics Unmasked, the live video version. We have Dr. Manning, Dr. Thompson, and myself, Dr. Henstrom, here to talk about various topics when it comes to facial aesthetics and treating your face, both surgical and non-surgical. As we take you through this journey, we're going to go over a lot of topics. This week, we're going to talk about chin implants. So I'm going to turn it over to Dr. Manning to lead us on this discussion about chin implants.
So chin implants are a really common procedure that's performed. I feel like it's a big bang for your buck. You get a lot out of it, and it can be done either awake or asleep. Dr. Thompson, who do you find are good candidates for a chin implant, or who are the people that come in asking for a chin implant?
Chin implants have a wide variety of applications because they can be anywhere from someone that's in their 20s that just has a really weak chin to someone that's in their 60s whose face is aged and dropped and descended, and so now they've kind of lost their jawline, lost their chin, developed a deep pre-jowl sulcus, which is this area just on the sides of the implant. And as you were saying, a chin implant is a great way to augment this area, strengthen the jawline that's permanent, as opposed to a filler. Sometimes we put fillers in there, but they really don't have the longevity and the immediate correction that a chin implant would have.
And how often would you say, Dr. Henstrom, you're doing these under general anesthesia versus doing them awake?
I'd say most of the patients that I do chin implants in are doing them awake. We're just using local anesthetic to numb up the chin and the jaw area. And as an isolated procedure, as a chin implant, most people can handle getting this done while they're awake. Now, when we're doing it in the setting of other procedures, concomitant procedures like a facelift, Dr. Thompson mentioned, or even more commonly, along with a rhinoplasty, those patients are usually asleep for those other procedures, and we're doing them at the same time. And I would just add one comment to what Dr. Thompson said about the patients. You look for that small chin, but you also want patients whose teeth come together well and they don't have an offset tooth issue, because if that's the case, they may need something along jaw surgery, along those lines.
I think all three of us perform this procedure pretty similarly. Mm-hmm. How are you doing it, Dr. Thompson? You know, if you take us through kind of a simplified step-by-step of how the implant actually goes in.
Well, there are multiple ways to place an implant. We prefer to place it externally, meaning not through the mouth. Sometimes it can be placed through the mouth, but that has some issues that can develop that we prefer to make an incision under the chin here. There's a natural crease under the chin in everyone, and we make a short incision there, and then we basically elevate all of the soft tissue that's sitting over the mandible or the front of the jaw and right down to the bone, and then we can lift that up and place this implant down in a pocket in that area. It's a very specific tight pocket, so the implant can't move around, and really a pretty easy recovery. Usually people have some swelling, but it's a pretty easy recovery. What do you tell them on possible complications or risks of a chin implant?
I think the main thing that you worry about is if the chin implant migrates. Once you place it into that tight pocket, you want it to stay put. If the chin implant moves around, is really, really helpful to make sure that chin implant doesn't go anywhere. Infection is another concern. And as you mentioned, making that incision on the bottom of the chin or underneath the chin as opposed to going through the mouth, I think helps to reduce that. I also put my patients on antibiotics at the time of the chin implant. I think you two do as well. And I think those are the main concerns, along with some numbness, which you see most of the time in the first few weeks after surgery.
Some people have some temporary numbness of their lip, but usually resolves within 1 to 2 weeks after surgery is kind of my experience with those. So,
I've got a question for you guys. How do you go about choosing the right size of the implant when you're putting it in? Because as Dr. Thompson showed, the sizers and the actual implant that we'll show you, they come in different sizes, basically small, medium, large, extra large. What do you look for to kind of make the decision on the size? Or do you know going in?
A lot of times I'll give the patients an idea. I think I'm going to use a medium, or I think I'm going to use a large based on what your chin looks like. We do have some aesthetic rules that we follow, but those have to be adjusted for individual patients just based on the anatomy of their jaw, or their chin, or their teeth. And if you put a chin too far forward, it can make a really deep crease here in the lip. And so there's all sorts of things that we have to kind of like judge during the procedure. That's why we use these sizers. We can put different implants in, see how it looks, see how it fits. and then make a decision based on those factors. I don't know if you have other things to
Yeah,
add.
and I would just say that I tell everybody I like to err on the side of going smaller rather than bigger. I think the last thing you want is to look over projected or abnormal. And so I kind of go in with the thought of, can we get away with a small implant as opposed to a medium or large? And certainly there are people who are candidates for larger implants, but what do you think, Dr. Hedstrom? You try to get a good idea before you go in there? Or?
It's a lot like what Dr. Thompson was saying. I usually have an idea of one or two sizes that I think it's going to end up being. Certainly on females, I'm going to err on the side of being too small rather than too big. Sometimes on men, if I'm in between sizes thinking, oh, medium's too small, large is too big, I might go on the large a little bit for a man just to give him a little bit more shape to the chin. That's kind of my thought process is when I put it in.
And then there are different types of implants in terms of the shape. What you said just kind of reminded me. Sometimes with a male, there are implants that have more of a square look to them, and sometimes a little bit more of a round look, or sometimes we're not projecting the chin itself, only projecting this area. So there's all sorts of different factors, different types of implants that we use. And that's part of the advantage of us just doing facial work is we see this stuff all the time, and so it helps us to have a lot of perspective on what might be best for patients.
Dr. Thompson, would you mind explaining what the chin implants are made of and how they work?
Sure. So what we have here is two different things. We have chin implant sizers here, and we have the actual implants here. And what these are is these just give us a kind of a gauge for how much projection or how much change someone's going to have. So for example, this one's smaller, we can put it in, this one's bigger, and we can see on the table what these are going to do. This is called a sizer. This isn't the implant. The implant itself is clear, and they're flexible like this. They're very inert, and so they're very unlikely to become infected. But this is what the actual implants look like.
And they're silicone. Everything
they're made out of a silicone, like a soft silicone material that's easy to remove if we decided that we wanted to remove one. But again, very unlikely to have a reaction or any infection.
We actually have one of the patients that had a chin implant and a rhinoplasty placed, and a chin implant placed, and she had a rhinoplasty at the same time. And I think we were going to talk through a little bit of her results. Dr. Hedstrom, what were your thoughts initially, as you're looking at her profile and balancing? What were your thoughts with the rhinoplasty and the chin implant, and why do you think it was a good idea to do both of those together?
Well, as we share these photos, you'll see the preoperative picture, and it's going to show a nose that's a little bit too large and a chin that's too small. The thing is, when you look at a person on profile, those two things, as well as the forehead slope and shape, are going to go hand in hand. So often when patients have a small chin, their nose is going to look too large, even if it actually isn't too large. In this case, this was a nose that needed to be reduced in size and a chin that needed to be brought out so you get the best facial harmony. So that's the discussion we have with a lot of rhinoplasty patients that are going to come in. We have to look at their chin and give them an assessment of their chin and say, you know what, your rhinoplasty outcome is going to be enhanced if we also do a chin implant. So that happens on a lot of patients. On this patient was certainly the case, as you can see in the post-operative photo. Smaller nose, but bigger chin gives a lot better balance and harmony to the profile view of the face.
And often they don't even realize that the chin is part of the picture, and that's part of our job to help kind of explain those balance features that you mentioned.
I think another added benefit often of the chin implant is when you elongate the jawline and you increase the depth from the point of the chin back to the angle, you actually do nice things for the neckline. And it can look like you took out fat or did other things under the neck, which may also be beneficial to do at the same time. But often just adding a chin implant will also improve the profile of the neck in addition to balancing the profile of the face and balancing the size of the nose with the chin.
So you bring up a great point, because we talk about this on a lot of rhinoplasty patients. Some of my most memorable and favorite outcomes in facelift patients and deep neck contouring patients also had chin implants put in at that time. And then when you pull that tissue back, there's just a little bit better, stronger structure to pull that tissue back against. And this is probably a topic for a discussion for another day, but that chin implant enhances those results as well.
I think we've covered just about everything for this patient and this topic. I think it's been a really productive. I think it's been a productive discussion. I don't know if you guys have anything else you want to add.
Well, I think this shows the importance of coming in and seeing experts that treat this all the time, because there's a lot of variabilities that go into this based off of individual patients, based off of the types of implants that we might consider, based off of what other procedures a person might need. So I think it just goes to show the importance of coming in and seeing a facial expert to discuss these things with them.
Totally agree. Thanks for joining us.